Hello, my friends. Today, I want to talk about something deeply personal, something that touches so many lives, yet often remains unspoken until it feels overwhelming. We're going to talk about diabetes, but not in a way that brings fear or judgment. Instead, we'll explore it as a signal, a gentle whisper from our bodies asking for a little more care. Recognizing these early signals is incredibly important. It's about being proactive, understanding what our bodies are telling us, and taking steps towards prevention and better management. This isn't about blame, it's about empowerment. Think of it this way: your body is always communicating with you. Sometimes it whispers, and sometimes it needs to speak a little louder. Diabetes, or even pre-diabetes, can be that louder voice, urging us to pay attention. I want to share a story with you, a story that might sound familiar. It's about Maria, a wonderful woman who, like many of us, was busy living her life. She started feeling tired more often, her skin felt dry, and she was making more trips to the bathroom. Maria initially dismissed these changes. She thought, "Oh, it's just part of getting older," or "I'm just stressed." These are common thoughts, and it's easy to overlook subtle shifts when life gets hectic. Thankfully, Maria's doctor suggested a routine checkup. That simple visit led to a diagnosis of pre-diabetes. It was caught in time, a critical window of opportunity. This wasn't a sentence, it was a wake-up call. Maria embraced this moment with courage and determination. She started taking daily walks, making simple, nourishing meals, and prioritizing rest. These small, consistent changes made a world of difference. Her story beautifully illustrates our core message today. Diabetes is not a life sentence. It's your body's signal for care. It's an invitation to listen, to learn, and to make choices that support your well-being. Early intervention is truly key. Whether it's pre-diabetes or an early diagnosis of diabetes, understanding and acting quickly can lead to remarkable reversals or effective, manageable health. You have more power than you might realize. So, what exactly is diabetes? In simple terms, it's about how your body uses sugar or glucose for energy. Glucose comes from the food we eat and is vital for our cells. Insulin, a hormone made by your pancreas, acts like a key. It unlocks your cells, allowing glucose to enter and provide energy. It's a beautiful, intricate system designed to keep you thriving. When this system doesn't work properly, glucose can't get into your cells efficiently. It builds up in your bloodstream, leading to high blood sugar levels. Meanwhile, your cells are left feeling starved for energy. It's not just about sugar, though. Many factors can influence your body's ability to manage glucose. Chronic stress, poor sleep, a lack of regular movement, and even dehydration can all play a role. Let's briefly touch on the different types of diabetes. Type 1 diabetes is an autoimmune condition. The body mistakenly attacks the cells that produce insulin, meaning no insulin is made. This often appears in childhood and requires insulin therapy. Type 2 diabetes is the most common form. Here, the body either doesn't produce enough insulin or doesn't use insulin effectively, a condition called insulin resistance. The good news is that type 2 diabetes can often be managed, and sometimes even reversed, through natural lifestyle changes. Gestational diabetes occurs during pregnancy. It usually resolves after childbirth, but it does increase the risk of developing type 2 diabetes later in life for both mother and child. Awareness is important here. Then there's pre-diabetes. This is a critical stage where blood sugar levels are higher than normal, but not yet high enough to be diagnosed as type 2 diabetes. Pre-diabetes is a powerful window of opportunity for reversal. It's a chance to make changes and prevent full-blown diabetes. Now, let's talk about the signs your body might be giving you. It's important to be aware of these, not to cause alarm, but to encourage gentle self-observation. If you notice these, it's a cue to check in with your doctor. One common sign is persistent thirst, often accompanied by frequent urination. Your kidneys are working overtime to flush out excess sugar, leading to increased fluid loss. Another signal is feeling unusually tired, even after a good night's sleep. You might also experience increased hunger even after eating. Remember, your cells aren't getting the energy they need. Blurred vision can also be a symptom. High blood sugar can affect the fluid levels in your eyes, causing temporary changes to your sight. This often resolves once blood sugar is managed. Slow wound healing is another important sign. High blood sugar can impair your body's ability to repair itself, making cuts and sores take longer to heal and increasing the risk of infection. You might also notice tingling or numbness in your hands and feet. This is a sign of nerve damage, which can occur over time with uncontrolled blood sugar levels. It's called neuropathy. Dry skin or persistent itchiness can also be indicators. High blood sugar can lead to dehydration and affect nerve endings in the skin, causing discomfort. While our focus is on prevention and management, it's important to briefly understand why these signals matter. Unchecked diabetes can lead to serious complications over time. These can include vision problems, even blindness, due to damage to the small blood vessels in the eyes. Heart issues and blood vessel damage are also concerns, increasing the risk of heart attack and stroke. Kidney problems or nephropathy can develop, potentially leading to kidney failure. Nerve damage or neuropathy can affect various parts of the body, causing pain, numbness, or digestive issues. So what should you do if you notice some of these signs? First and foremost, don't panic. Take a deep breath. This is about gentle, proactive action, not fear. The most important step is to consult your doctor. They can perform a simple blood test, like an A1C test, which provides a clear picture of your average blood sugar levels over the past few months. This test is quick and easy. Once you have information, you can begin to make informed choices. Let's talk about some foundational lifestyle changes that can make a profound difference, whether you're preventing, managing prediabetes, or living with diabetes. Incorporating daily walks into your routine is incredibly powerful. Even a brisk 10 to 15-minute walk after meals can significantly help lower blood sugar levels. Movement is medicine. Reducing sugary snacks, especially in the evening, can have a huge impact. Our bodies are less efficient at processing sugar later in the day. Opt for whole, unprocessed foods instead. Make water your primary beverage. Drinking more water instead of sugary juices or sodas is a simple yet effective change. Hydration supports every bodily function, including blood sugar regulation. Managing stress is also crucial. Chronic stress elevates cortisol, a hormone that can raise blood sugar. Explore deep breathing exercises, meditation, hobbies, or spending time in nature to find your calm. Prioritizing quality sleep is non-negotiable. Aim for at least 6 hours, ideally 7 to 9, of restful sleep each night. Poor sleep can disrupt hormone balance and increase insulin resistance. Let's dive a little deeper into specific dietary recommendations. As mentioned, walking after meals, even for a short period, is a fantastic habit. It helps your muscles use up glucose. Adding fiber to every meal is another game changer. Fiber slows down sugar absorption, helping to stabilize blood sugar levels. Think leafy greens, seeds like chia or flax, and raw vegetables. Choose whole foods over processed options whenever possible. Whole foods are packed with nutrients and fiber, while processed foods often contain hidden sugars, unhealthy fats, and artificial ingredients. Consider incorporating natural ingredients known for their blood sugar benefits. A sprinkle of cinnamon in your oatmeal, a splash of apple cider vinegar in water before meals, or a squeeze of lemon in your water can be helpful additions. These are small, supportive steps. My friends, prevention is not a complex, overwhelming plan. It's a daily rhythm, a series of small, sustainable steps that you weave into your life. It's about self-care, listening to your body, and responding with kindness. You have the power to make choices that support your health and well-being every single day. Embrace this journey with hope and empowerment. Every small step forward is a victory. Let's spread this message of awareness and empowerment. Share this information with your loved ones, your friends, and your community. Together, we can create a ripple effect of health and understanding. Remember, your body is always on your side. It's giving you signals, and by listening, you're taking the most loving action possible. You are capable of incredible health and vitality.